Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
Boost your health today with Simply Nature Power Pack, a 5-day combo pack of Simply Nature PPARS for immune boosting and Simply Nature Cleansing Plus for effective detoxification. Experience this dynamic duo now. Available on Shopee, Lazada, and our website www.simplynature.asia and our office here in BGC. Grab yours today!
One reason why I recommended initially PPARS is because it can induce lung cancer cell death. The main reason why I tried PPARS liquid, and it did well for the patient. It helped with the tumors. The enlarged abdominopelvic lymph nodes were not detected. This was gone. So that was something that I was actually quite surprised. A 12-centimeter tumor disappearing.
Everybody turn to your neighbor and say, do more. Right? Don't just think there is no one product that will cure you of cancer. Okay, that is like it's like a scammer trying to sell you something. All right, it is a comprehensive approach. When you need surgery, do the surgery, but prepare for the surgery so that you recover well, right? And then if you need to do chemotherapy, radiation therapy, do it. So this is where PPARS really comes in. It's a gene activator, so it's a signaling pathway. It switches on your pathways, your systems. Then the other nourishment that you take will be properly used. Is it easy to understand now?
Now let's not keep you waiting. We are now officially opening the AMA or Ask Me Anything portion.
So she has to take maybe just the capsule or the powder just to regulate blood sugar. And then undergo the surgery, and after the surgery, to aid in wound healing also and for recovery, she can continue the capsule.
I can safely say this, all LJ products are great. But if you have acute illnesses like cancer, then we are a world of a difference. Because if you want chlorella, take chlorella. Diba? If you want spirulina, take spirulina. When you take Simply Nature PPARS, you're taking our microalgae for its PPAR agonist.
We are always with you from start to finish.
Good day everyone, I am Beth. And today, kasama ko po si Ma'am Mabs to tell her cancer journey. So, hello Ma'am, good day po. Kamusta po kayo Ma'am?
Okay naman. Ngayon okay ako. Malakas.
So Ma'am, can you tell me something po kung sino po ang isang Mabs?
Ako po si Ma'am. Nanayanog po ako ng cancer noong November 2023. Ang simula talaga ng aking nararamdaman noon ay sa ipin lang. And then, ayun, nakita na may cyst na, may bukol na ako sa gum. Pagkatapos, required naman ako for MRI. Lumabas sa aking result na mayroon nga daw akong osteosarcoma. And then, na-confirm nung myopia ko na ito ay adenoid cystic carcinoma. Which is, rare daw yun, sabi nila. May possibility siya na umakyat sa pataas at kumalat pa sa pababa ang liig. Nag-undergo ako ng operation, which is tinanggal yung kalahati ng nalagal ako. Kaya ganito ako magsalita.
Paano po ninyo na-meet or nakilala si Dr. Jansen and yung Simply Nature PPARS? Kilala ko po si Dr. Jansen at na-meet ko po yung Simply PPARS. Dahil po nanonood ako sa Facebook, nung nag-take na ako ng Simply PPARS, talagang malakas po katawan ko. Simulan sa po, hindi ako sinipon, hindi ako nilagnat. As in, malakas ako. Talagang maraming na-amaze sa akin. Pumayat ako sa treatment ko, pero nakikita nila na malakas ako. Kaya pati yung mga team na radiology, ang sabi sa akin na maganda daw yung malat ko, hindi daw nasunog. Dahil yun sa simplificar. Kasi yun ang katuwang ko. Ako'y nagpapa-radiation. Sa umaga, radiation ako. And then sa gabi, nagtitik ako ng PPAR. Dati, ang required sa akin ay chemo at radiation. Pero nung nakita na on ko na nag-stay lang yung at walang kumalat kahit sa parte na katawan ko, radiation na lang, na-required sa akin. Ayun, papasalamat talaga ako. At nakilala ko yung simplificar at Dr. Jansen. Malaking tulong talaga. Parang hindi ako nagpapagod. Kilos ako ng kilos, ako naglilinis, ako nagluluto, at namamalimpi pa ako mag-isa. Pero kilos pa rin ako ng kilos, parang bigla akong maisip na, may uuupin ako na, may ganito ako, gano'n. Dati kasi may osteoarthritis na alam ako. Pero mula nung nag-test din ako, nawala lahat yung nararamdaman ko. Malakas ako at maganda yung tulog ko. Talagang pahagising mo sa umaga, wala kang nararamdaman na, masakit yung ganito ko, ganyan, di ba yung kapag nagkakaedad na tayo, masakit yung tuhod, masakit. Ako asin wala parang fresh, parang bumata ang pakiramdam ko. At marami nagsabi, mas naging blooming lang ako ngayon. Dahil yan sa pagsisin ko na simplificar. Ako po, si Ma'am, nanayagnos ako na adenoid cystic carcinoma. After ko maupirahan, nag-take ako ng Simply Nature-inc at noon po ako lumakas. Napabilis ang aking paggaling. Hilos ako ng hilos. Nakakalimutan ko na may sakit pala ako o naoperahan ako. Kaya sa simplificar, lumakas ang katawan ko at napabilis yung paggaling ko. And I trust Simply Nature.
Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
Boost your health today with Simply Nature Power Pack, a 5-day combo pack of Simply Nature PPARS for immune boosting and Simply Nature Cleansing Plus for effective detoxification. Experience this dynamic duo now. Available on Shopee, Lazada, and our website www.simplynature.asia and our office here in BGC. Grab yours today!
One reason why I recommended initially PPARS is because it can induce lung cancer cell death. The main reason why I tried PPARS liquid, and it did well for the patient. It helped with the tumors. The enlarged abdominopelvic lymph nodes were not detected. This was gone. So that was something that I was actually quite surprised. A 12-centimeter tumor disappearing.
Everybody turn to your neighbor and say, do more. Right? Don't just think there is no one product that will cure you of cancer. Okay, that is like it's like a scammer trying to sell you something. All right, it is a comprehensive approach. When you need surgery, do the surgery, but prepare for the surgery so that you recover well, right? And then if you need to do chemotherapy, radiation therapy, do it. So this is where PPARS really comes in. It's a gene activator, so it's a signaling pathway. It switches on your pathways, your systems. Then the other nourishment that you take will be properly used. Is it easy to understand now?
Now let's not keep you waiting. We are now officially opening the AMA or Ask Me Anything portion.
So she has to take maybe just the capsule or the powder just to regulate blood sugar. And then undergo the surgery, and after the surgery, to aid in wound healing also and for recovery, she can continue the capsule.
I can safely say this, all LJ products are great. But if you have acute illnesses like cancer, then we are a world of a difference. Because if you want chlorella, take chlorella. Diba? If you want spirulina, take spirulina. When you take Simply Nature PPARS, you're taking our microalgae for its PPAR agonist.
We are always with you from start to healing.
board-certified pharmacist and your health advisor here in Simply Nature. We are an international distributor of food supplements made from a unique strain of microalgae called PPARS, which has been tried, tested, and certified to support not only cancer treatment, but also general health and metabolic syndromes like hypertension, diabetes, and high cholesterol. And today, we are now in the second part of our October's Breast Cancer Awareness Month special entitled The Many Faces of Breast Cancer. Last week was about HER2 positive and HER2 negative. But moving forward tonight, it's called triple positive and triple negative. Now, without further ado, let me call on our first expert, a seasoned international speaker on a wide range of topics from personal success to healthcare, who is also the founding director of Simply Nature International, our PPARS expert from Singapore. You all know him. It's Mr. Shyan Lim.
Hi, Jhen, and welcome everybody. It's so good to see everybody on this program again. There's the second part of our breast cancer series, right, as Jhen has mentioned, and in support of Breast Cancer Month. So last week we had a great conversation, many questions. So always the most popular segment of this program, and I'm sure why you're tuning in or why your friend recommended you to tune in, is that you can ask us questions. So we'll be interacting with you. Just type in your questions on the chat, and me and Dr. Jansen, is Dr. Jansen joining us tonight?
Yes.
All right, so me and Dr. Jansen will be answering your questions. So we'll see you again at the AMA Ask Me Anything segment right after the very short discussion. So I'll hand the time back to Jhen as she introduces Dr. Jansen.
Right. So next is an honor to present our second esteemed speaker, Dr. Jansen Kalalan, a distinguished graduate of St. Luke's College of Medicine. Dr. Kalalan is a diplomate of International Board of Lifestyle Medicine and the Philippine College of Lifestyle Medicine, currently serving as a consultant at renowned institutions, including Alta Integrative Medicine and Wellness Complex of Perpetual Health Medical Center, Las Piñas, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group, where he practices integrative oncology. Let's all watch this.
Hi everyone! Tonight we're going to talk about the difference between triple positive and triple negative breast cancer. These terms actually comes from the status of the immunohistochemical staining. So again, from the first part of the webinar, I have discussed there how do we get immunohistochemical staining, what it means. So depending on the result, triple negative, triple positive breast cancer, or the other types of breast cancer. So from the staining, we can actually have 4 different types of breast cancer. So the first one is ER/PR positive, HER2 negative. So ER and PR means estrogen receptor and progesterone receptor. So these are your hormones. HER2, again, is human epidermal growth factor receptor 2. Okay? So the first type is ER/PR positive, HER2 negative. That's luminal A. And this type of breast cancer actually has the best prognosis out of the others. The next one would be ER/PR negative and HER2 positive, which we discussed earlier in the first part of this webinar. Now, if the breast cancer is positive for ER/PR or estrogen and progesterone receptor and positive for HER2, then that would be your triple positive breast cancer. If the breast cancer cells do not have estrogen receptor, progesterone receptor, and HER2 receptor, then this is now triple negative breast cancer. What makes triple positive breast cancer unique is that hormone therapy and trastuzumab therapy can be used for you. So hormone therapy like anastrozole, letrozole, tamoxifen, your fulvestrant, all can be used as a treatment for hormone receptor positive breast cancer patients. So in other words, if your ER/PR statuses are positive. For trastuzumab, this can only be used for HER2 positive breast cancer patients. How common is triple positive and triple negative breast cancer? Triple positive breast cancers typically comprise around 10% of all breast cancer diagnoses. For triple negative breast cancer, it typically comprises around 10 to 20% of all breast cancer diagnoses. What are the risk factors for developing triple positive or triple negative breast cancer? Actually, the risk factors for subtypes of breast cancers would be the same risk factors for developing breast cancer in general. So again, the most important risk factor would be age. So women who are older would typically have a higher risk of developing breast cancer. Another one is a family history. If you are someone who has strong family history, like your grandmother had breast cancer, your mom had breast cancer, your aunts had breast cancer, your sister had breast cancer, then chances are you would have breast cancer in your lifetime. Another important risk factor is smoking, no? Lifestyle risk factor. So aside from smoking, alcohol beverage drinking is also another one. If you are sedentary, if you are overweight or obese, then chances are higher for you to acquire breast cancer later on in life. So what are the survival rates of triple positive versus triple negative breast cancer? If you look at the literature, the numbers are very wide. However, typically the trend goes into triple positive breast cancer having a better prognosis compared to triple negative breast cancer. So again, the reason is triple positive breast cancers, we actually have a lot of treatment options that we can use, no, for this type of breast cancer compared to triple negative breast cancer, wherein the only conventional therapy that is available is chemotherapy. And we all know how chemotherapy affects the overall survival of patients. Yeah, and I'll leave it at that. So if you have triple negative breast cancer and your oncologist actually recommended chemotherapy for you, and if you're worried, no, what other supplements or what other things that you need to do to support yourself to go through the chemotherapy treatment, I have encountered Simply Nature PPARS, and it is one of the supplements that I use, no, to support chemotherapy patients to finish their treatment. One benefit that I usually see in my patients is that they are stronger, fatigue is less, they sleep better with Simply Nature PPARS. Why? It's because Simply Nature PPARS has very good antioxidant properties, antioxidant characteristics that would be quite good to use against the inflammation that is brought about by the effects of the chemotherapy. Another one is chemotherapy typically suppresses your immune system, and Simply Nature PPARS has strong immunostimulatory effects as well. No? It helps bring about the strength of your immune system. It helps activate the genes that is necessary to generate more white blood cells for patients undergoing chemotherapy. That would be all for our webinar tonight. If you have questions, let's now answer them in the Ask Me Anything segment.
Right, there we have it. I hope you learned a lot, and now we want to hear from you. If you have any questions, kahit Tagalog, okay lang po, please type them in the chat. We'll do our best to address as many as we can. And now, let me call on our experts, Mr. Shyan Lim and Doc Jansen Kalalan. Good evening po, gentlemen.
Good evening. Hi, Jhen. Hi, Doc. How was your trip
Hello.
in Taiwan?
Good, very good. Taiwan is really beautiful and the food is really, really great.
Did you manage to get the theater pineapple tarts?
Yes, I was able to. Of course.
Okay. Of course. Good that I see that you didn't put on weight in Taiwan.
Yeah, we did a lot of walking. And it was
Yes,
just a
a lot of
short time.
walking.
I was there for the conference, so not much eating. Although I really explored a lot of the food.
Yes, Taiwan is really good. So yeah, Jhen, Doc, welcome back, and we're back tonight again to answer your questions. Both Doc and I always enjoy this segment where we interact with everyone. So, Jen, why don't we begin?
Okay, let's dive in with the first question thrown to us privately. Okay, her question is inflammation always expected during chemo journey?
Oh yes, 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 definitely. Just imagine bombarding yourself with you know, a nuclear bomb. So it's similar to that effect. Chemotherapy will eradicate cancer cells and healthy cells likewise. So together with that, inflammation is gonna increase. Um, with the inflammation, you'll experience a lot of oxidative stress. And the oxidative stress is actually the one that, a part of chemotherapy, no? One of the mechanism of actions that will kill the cancer cells, no? So it's mainly oxidative stress and inflammation. Okay, so yes, definitely inflammation is always there if you have, if you're undergoing chemotherapy.
And this is why managing inflammation is going to be one of your important strategies in your fight against cancer as you adopt chemotherapy protocols. That also includes radiation therapy. So that's going to be, and even targeted therapy, because basically inflammation is one way of looking at inflammation is that it's where your body harnesses or collects or assembles its resources to fight. So every time there's a fight, there's going to be inflammation. So inflammation by itself is not bad, but excessive inflammation is going to have its negative effects. So you want to do things that lower inflammation. That includes the food that you eat. So don't eat like too much fried food, and all these things also add to inflammation, right? And in terms of supplementation, this is why Simply Nature PPAR protocols are so good, because they not only lower inflammation because of antioxidant properties, but we also modulate your inflammatory responses. So that is actually at a gene level. So it actually triggers the PPAR pathways that regulate inflammatory response. So that will help your body modulate your inflammation more effectively. So combine that, it's one of your best partners. So it's very different from taking multivitamins where you just get minerals and vitamins, right? Or just taking antioxidants. There's more, so PPAR is really quite ideal for cancer patients and their treatments.
Thank you, Doc. Thank you, Sir Shyan. Before we move on to the second question, I'd just like to greet our avid viewers, Miss Naomi Elona Veras, Sordelina Durupan Cura, Emelda Oracion, and Edna Alarcon Corpus Aveo. I can sense the happiness of our viewers because they're enjoying the 10-10 sale. Okay.
Okay.
Okay. Next question coming from YouTube. Okay,
YouTube.
from Zeph
That's great,
Gabriel.
YouTube.
Yes. Okay, so his question is, do you have any lab test that is not painful?
Actually, lab tests are
Okay.
not really painful, right? Unless you're afraid of needle.
Yeah, but I think painful here, the term masakit in Tagalog can mean, the literal painful, literal pain, or painful in terms of your pocket.
Okay.
Nice catch.
Yeah.
Nice catch, Doc. Yeah.
Now, for in terms of pain, right? There are lab tests that are not gonna be, that painful in terms of literal pain, like simple blood tests, no? Well, of course, there will be pain from the needles, but they're just gonna be needles, okay? It's gonna be different from, biopsies, wherein a piece of the tumor would have to be collected from you. However, of course, for biopsies, you'd be under anesthesia. Okay, so it's gonna be relatively pain-free as well. Yeah. So now, in terms of, your pocket being painful, unfortunately, here in the Philippines, no, our country really has a long way to go in terms of our healthcare system. So it's gonna be always something out of pocket. for everything, no, every step of the way of our healthcare system. Now, for lab tests that are gonna be, quite relatively cheaper are those like your metabolic panels. Tests to diagnose cancer are gonna be way more expensive. It's gonna be at least 10,000, no, 10,000 pesos, and up. It can go all the way up to 200,000 pesos actually. So those tests are genetic analysis already, that tests that analyze your DNA, tests that try to detect circulating tumor cells. So they're gonna be in the order of hundreds of thousands of pesos. Yeah, your PET CT scans, CT scans, MRIs, your X-rays, no, your CT scans. Majority of them are gonna be quite expensive. Probably at least 15,000 and up. Cheapest PET scan that I know of is 55,000. I think 52,000 pesos, which is in Perpetual Health Medical Center, Las Piñas, where I practice. Aside from that, yeah, I think those are about it, no? Yeah. Mm.
Okay, she actually has a follow-up question. Is there any equipment here in the Philippines that can check your breast lumps that is not hurtful? Maybe she just experienced like a mammogram.
Mammogram, yes, correct,
Does it
correct.
hurt?
Yes, mammograms hurt, no? Because the machine would have to compress your breast quite heavily. Yeah, quite tight, yeah. This is so that we get a good resolution of the breast tissue. A counterpart of that would be ultrasound, no? So ultrasounds are a lot more, you are gentler because it's gonna be operator dependent, meaning how hurtful it is entirely depends upon the skill of the one who's doing the ultrasound. Okay. Other than that, if this is for screening, no. Other than that, if we're trying to characterize a breast lump, no, the breast lump is there already. We're trying to characterize if it is malignant or not. CT scan is another modality, imaging modality that you can look into. The CT scan it's not gonna touch your breast at all. So you're just gonna lie on a bed, then they're gonna put you inside the machine, no? Put you under the machine. So those are some of your options early on if you're still looking into what the characteristic of your breast is. Is it the characteristic of the breast lump is, no? Is it benign or malignant?
Thank you, Doc. I think that also answers the question of Leticia Bacornay from Facebook. She said, what kind of test to have to know the kind of breast cancer?
Oh yeah. Type of breast cancer, if you are talking about the receptors, then it has to be biopsy. Okay. After the biopsy, the pathologists will do further tests on the tissue sample to determine what type of breast cancer you have. So that is the test to know. Yeah.
A related question coming from Judith Pasio. What is true cut biopsy? TRUCUT.
Yeah, true cut biopsy. Let me just check. This is the first time that I heard of this term, no, which is true cut. True cut is a brand.
Oh,
Yeah, it's a brand. It's a minimally invasive technique used to obtain tumor. So I think this is a proprietary brand, no? TrueCut by a certain company which developed biopsy technique. So they patented the technique, which is TrueCut biopsy. Okay. So I'm not quite sure what it is. You have to ask the one who's doing it, surgeon. But definitely there would still be some samples taken from the tumor. Okay. Yeah.
Okay, thank you, Doc, for the clarification. Okay, going back to PPARS, a question coming from Rochelle Esternon. Good evening. What is the different effect of PPARS powder versus liquid?
Okay.
Sir Shyan?
Yeah, I'm muted. I was muted. Okay. The PPARS liquid is the most concentrate form of the PPAR extract, all right? So it is the most powerful. It is the most powerful. It is also the most effective, okay? However, and it is ideal for all conditions. The only one condition where the PPAR powder would actually be superior to the PPAR liquid would be for those with CKD, especially when it's the late stage CKD. The reason is that the mineral content in the liquid is slightly higher. And so you know, for serious cases, our doctors may prescribe more than 1 vial a day. So that's when the powder's dosage can actually be increased a lot more than the liquid without any fear of the mineral content. But for every other case, the liquid is always better than the powder. Now, then, if the liquid is always better than powder, why don't we always use the liquid, right? The real reason is actually cost, okay? It is the best and most powerful, but it is also the most expensive. Does this mean that if you use powder, you are lugik or you're not giving yourself the best treatment? The answer is no, all right? Yes and no, okay? If you take the powder, the effect will be longer. That means it will not be as fast or not as intense. However, in cancer, the onco prescribes, right? So if you don't finish the sessions, you won't get the full effect. Now, that's in a similar manner, when you go on a protocol, you want to be able to sustain it. You have to be able to sustain the PPAR protocol to support your chemotherapy. So if your chemotherapy lasts 3 months, then you gotta have the ability to stay on the liquid for 3 months also. Now, the other solution to this is the liquid is always the most powerful. So I know like doctors who are very familiar and very knowledgeable in how to support a cancer patient, like Dr. Jansen, will often start with the liquid. Why? To confirm that the liquid will have effect on the patient. And you know, when you want to start your cancer treatment, whether you are using totally natural or a combination or conventional, then you're using PPAR liquid to support, right? Then what you want to do is always have to start with the strongest so that your body gets primed up. Everything gets momentum. There's a momentum that you start, right? Now, after that, if it's financially, you got to talk to the CSO, the client service officer like Jhen, or your healthcare specialist that supports Doc Jansen. You got to be honest with them and tell them if there is any financial restrictions, right? Because if there are financial restrictions, then we'll do the best combination. For example, you start with the liquid, then you move on to the powder. And you might keep a few, and you might get an additional box of the liquid to be used on the days like immediately after your chemotherapy. That's when your body is the weakest and you need the strongest boost. So then the next day after that, you can go back to the powder, you know. So there are a lot of combinations. So what we want to do is that we are here with you from your start all the way, right? It's not just your first month. We are going to be with you until you clear your 5-year mark. So part of that strategy is also to look at how you're going to plan your finances, okay? But in short, the liquid is the best, powder next. However, the powder is something that is also really, really it's very effective, and it has the advantage of being able to be something that you can sustain financially. Of course, if money is not the issue, then stay on liquid. I actually have clients who stayed on liquid 2 vials a day for 2.5 years. So that person is actually financially very strong to be able to do that. Okay, so there's a combination. But I hope that answers your question. And if you really, really want to know whether the product is for you, you want to get, how shall we say, a strong indication that this is the right protocol for you, start on a liquid. Because for our liquid, usually within 48 to 72 hours, you will feel the improvement. It doesn't mean your cancer markers go down in 24 hours. Neither does it mean that your tumor disappears in 24 hours or that it shrinks in 24 hours. But what you will feel is, if you're a cancer patient, you'll feel the strength coming back, and you say, okay, this is going to help me. Right? So that's another reason why the liquid is something that you can see the effect very quickly.
Thank you, Sir Shyan. Would you like to add anything, Doc?
Yeah.
Seeing that Sir Shyan
good,
is our
good.
PPARS expert. Okay. Going back to our YouTube viewers, F. Gabriel. Okay, she added, I have a lump since grade 3, but now I'm already 44 years old. So the lump is still there, and sometimes I can feel it moving. And then, oh, she was diagnosed with 51 lumps, but they're all benign. But oh, she wasn't able to get back to check it for all the monitoring. So her question is, can I just use PPARS together with a healthy lifestyle and no need to go through checkup like mammogram?
Okay, 51 lumps. I'm curious, no, how the what imaging test you underwent, no, for the radiologist to diagnose you with 51 lumps. Yeah, I'm curious. I think it would be best for you to consult, no, schedule an appointment so I can take a look at the labs. But if you just want to, do something for yourself, no, um, I think, yeah, taking PPARs would be good, but I will also add in a little more detoxification supplements, no. So I have a protocol for detox, and PPARS is part of the protocol. Okay, so this protocol involves a tea to detox your kidneys and your liver. I use serapeptase. It's an enzyme that clears away biofilms in your gut, and a probiotic supplement. Okay, this is to basically heal your gut. Okay, and eliminate the heavy metals, no, together with the PPAR. So, I'm not gonna say that it's gonna be a guarantee for the lumps to disappear after this. After all, it's not really the lumps that we want to, you know, um, to resolve, no, or make the lumps go away, because it has been there since you were grade 3, you know. So, I mean, if it was benign for that long, it's not gonna turn into cancer just like that, no, anytime soon, unless there is a trigger. Yeah, unless there is a trigger that, turns one lump to become cancer, no. But it's not gonna be because you have lump, that's why it became a cancer. There has to be a carcinogenic exposure that triggers the malignant transformation. Okay, so if you want to do something for this, then I think it would be wise to just make yourself healthier, no. So start to detox and then eat a healthier diet, exercise, live a healthier lifestyle. Right now, the goal is not to make the lumps disappear. It's first and foremost is to make yourself healthier. Okay, because once you go into menopause, some of these lumps are gonna disappear anyway. So, I mean, just monitor yearly, see if some of the lumps are increasing in size, see if their characteristics change on imaging tests. Then we'll go from there. If nothing else changes, then it's not gonna be a problem. But if you want further testing, if you're afraid of, if you're wondering if you have elevated risk of developing breast cancer, I know of screening tools, no, screening tests that we can go for to screen, no, to take a look at your risk for developing breast cancer later on. So these tests involve genetic analysis already. Yeah.
Yeah, so as Dr. Jansen said, you had this since you were grade 3 and it didn't become malignant. So unless there's a trigger, I don't think you need to worry yourself. And obviously with 50 over lumps, surgery is not an option also, because it will literally be a mastectomy. So I can only share with you one encouraging testimony in my own family. My niece Marissa, she had a tumor growth in her mouth, right? And then when she was young, of course, it was benign. It was benign. So the pediatrician said, still to be safe, let's just cut it out. And my sister was ready to do that until she found out the general anesthesia. So she just didn't want her 4-year-old daughter to be under general anesthesia. since it's really a benign thing. So she was quite conflicted. And my mom said, why don't you take Kuya's products, right? To cut the story short, my niece's cyst disappeared after 1 month. So again, I'm not saying that your lumps are the same as the cyst in my niece's mouth. I want to highlight that what PPAR agonist does is that it does prime the immune system. Literally, when we publish our paper, right, it improves the immune system by improving dendritic cell activity, macrophage cell activity, NK cell activity. So like the macrophage cell activity, the dendritic cell activities, these might cause your immune system to identify the lumps as unnecessary growth, and then that's why our protocols are very good for tumors, whether they are benign or cancerous, because they are not they're not the usual in the body. So the immune system does actually go and clear it out. So but again, everybody's biochemistry is slightly different, as you can see, from grade 3 until now, having so many lumps, and yet it's not detrimental to your health. But if you want to try on that part, go ahead. And the good news is that it's going to help with your all your metabolic processes. So as we age, we want to manage inflammation, right? So you want to manage inflammation, then you also want to manage your metabolic syndromes, like your blood sugar, high blood cholesterol. So that's going to be helpful. Doc, I think I would recommend, just for general health, and let's see if she might find some smaller lumps disappear. Perhaps something economically very manageable. You can try the soft gel for 1 month and then just go on tablets after that. And because since your lumps are benign, there's no time factor. So the wonderful thing about soft gel and then just tablets, right? So soft gel just to kickstart everything, and then tablets, is that the longer you take the PPAR tablets, the effect actually accumulates. So we have actually done our clinical research on that. So if you constantly eat the PPAR tablets, the effect of the same amount of tablets actually increases over time. And since again your growths are benign, we just let the body take its time, and you observe the difference maybe over 6 months, right? Definitely your other blood works will improve. And then your chronic inflammation will go down, your energy level will go up as well. So I think it's it's positive in every angle. All right? Yeah.
Yes, and actually, it's the perfect time to try it because it's on sale. So stay tuned at the end of the webinar. I have good news for you. Okay. Next question coming from Facebook from HGG Vasquez. Okay. Want to ask if the patient with breast cancer experienced edema in her hands. So what is the best remedy for that?
You have to use your hands. Physical therapy. Physical therapy is the best solution for that. And you have to use your hands, no? Now for breast cancer patients who experience this, this phenomenon is also known as your lymphedema. Lymphedema in breast cancer patients happen when you undergo surgery. It's a side effect of the surgery, no? The type of surgery for this to happen, no, is when they get the lymph nodes in your armpit. Okay, so that specific procedure is modified radical mastectomy. Okay, so that's it doesn't always happen, but if it does, the solution there is physical therapy. It's really just physical therapy because it's an anatomical problem. Okay, so you really have to move your hands so that the fluids don't pool on your hands and on your arm, basically.
Okay, thank you so much, Doc. Another question drawn to us privately. Can ozone therapy work together with PPARS and vice versa? I don't want to go for chemo. Case is only stage 1 breast cancer.
Oh, stage 1.
Stage 1, yeah. I haven't seen any study combining microalgae and ozone therapy. But here's the thing, no? Ozone therapy cannot be used alone to treat cancer. The benefit that you get from ozone therapy is immunomodulatory effect. So it can improve your immune system, improve your immune function. It can improve oxygenation since we're giving patients basically oxygen, no? An oxygen and ozone mixture. Another benefit you can get from that is antioxidant effect. So for cancer patients, inflammation is going to be all over your body. So when we give ozone therapy, inflammation goes down. The third benefit you get from there is germicidal effect. So ozone therapy can kill viruses, bacteria, and fungus, no? Fungal infections. In fact, initially when ozone therapy was discovered, ozone is not yet therapy, no? Ozone is being used as a disinfectant, no, for industrial use. It's not for medical use initially. During World War One, antibiotics haven't been invented yet during that time. So the doctors are trying to rack their brains, no, what kind of anti-infectious things can we get, no? Can we develop? So ozone therapy came from that, no? Yeah, it was developed because of World War One. So since then, they're using ozone therapy, oxygen therapies, no, as a way to treat infections. So going back to your question, can I combine ozone therapy with other treatment modalities? No, yes, you can actually use ozone therapy to improve chemotherapy outcomes, radiation therapy outcomes, improve wound healing, make high dose IV vitamin C more powerful. Combined PPARS, ozone therapy in PPARS, I don't think there's gonna be any I'm not 100% sure, no, if there's gonna be any synergistic effect because the mechanism are different. The way they improve the body is different, no? PPARS try to detox. It detoxes your body. It improves metabolic processes. It improves your immune system in a different way in that it activates genes.
Yeah.
Ozone therapy is direct oxygenation.
Direct.
Yeah, and
it facilitates. Because once your genes are activated, you want a ideal condition, right? So by giving your body oxygen, you're just going to improve everything.
Yeah. So well, yeah, I think yes. No, the answer is yes. There are synergistic effects between ozone therapy and PPARS.
Yeah.
Theoretically speaking.
Yes.
Although I haven't specifically looked into this outcome yet, no, for my patient because there are very important parameters that I have to focus more on. No? Now when it comes to using ozone and PPARS only to shrink tumors, if the tumor is benign, there's a possibility that it can go away, especially if it is it's cysts. So these are cysts, cystic structures. If it is malignant, I don't know. I don't know. Okay, if it is malignant. So why did I answer no? If it is benign, yes. Because ozone therapy. Okay. Let's go back one bit, no. Lipomas are benign mass found on your fats, no. And lipoma is a fat. It's a benign fatty tumor. Okay? We can use ozone therapy to dissolve those lipomas because ozone can dissolve fat. Okay? Actually, we have something what we call as meso-ozone. So this is for aesthetic, cosmetic purposes already. We mix mesotherapy and ozone therapy. So mesotherapy is a procedure wherein they inject a solution into your fats to dissolve the fats. So it's similar to liposuction, but a little less scary liposuction. No, yeah. So that's the procedure. But instead of just injecting you with the solution, they inject the solution and ozone. And for benign, cysts, we can actually inject ozone itself onto the lesion to dissolve it. Okay, there is such a procedure. And this was taught to us during our workshop. Okay, so in that sense, ozone therapy, yes, it can really help quite a lot for benign tumors, especially cysts. PPARS, I am also using them to address benign tumors, especially benign tumors on the thyroid. I have had several patients who have thyroid cysts, thyroid nodules, which disappeared completely. These patients are for biopsy already.
Wow.
They're looking for other solutions because they're quite afraid of the biopsy. So they tried, PPARS only. Took it for like 2-3 months. Then when they went back to their doctors about to do the biopsy, their doctors cannot find the tumor, so nothing to biopsy. Yeah.
Wow.
Went home. Yeah.
So again, one thing that Dr. Johnson mentioned is I think the word Dr. Johnson was trying to address synergistical effect, which means 1 + 1 is more than 2. All right, where it's really, really complementary. I want to say that for sure, ozone therapy and PPARS, there is definitely arithmetic synergy. 1 + 1 is definitely going to be 2. It's not going to be 1 + 1 is 1.5, right? So is that important in your strategy to fight cancer? Yes. For example, because you're approaching the same functions or outcome from 2 different directions. It's like you want to have strong arms. You do bicep curls and pull-ups, right? They strengthen different muscles, but the end result is that you're going to be able to lift a heavier box, right? In fact, it's going to be better that you exercise both your shoulders and your biceps. It's going to allow you to lift the box more effectively. So when we do treatments, sometimes treatments may not be synergistical, as in they were not designed to specifically for one another. It's like coffee and cream, right? It's like made in heaven, but it will work together, right, from different angles. So in that effect, it's going to be definitely 1 + 1 is going to be at least 2, and most likely it'll be 2.5. But is it 1 + 1 = 6? Well, that will be very synergistical. Okay, so that we cannot say, but definitely in the method of action, the mechanism of action, right? PPARS and ozone therapy will work together. So very easy to understand. Dr. Johnson said PPARS activates genes. Ozone therapy basically oxygenates the body. In the simplest explanation, also detoxes. So that will give your body that boost, right? And the genes are awakened. So obviously it's going to help one another. The thing about your case is benign, all right? Sorry, not benign, stage 1. So I want to remind you, please set some red lines. Right? Set some red lines. That means whatever protocol you're doing now, at stage 1, you have the option, a window of time, right? That you can try to treat your condition naturally, okay? Because if you really don't want conventional medicine. But please, once it goes into, if in the event that it doesn't have the effect that you want, please do consider the other options, which include surgery and everything. Like, again, the treatment of cancer we have had patients with 6 cancer brain tumors. Just on the PPAR protocol, they have recovered, right? But yet we have patients who, other patients with similar conditions, the PPAR protocol was not enough. So every patient is a unique condition. Courage with, let's say, your friend's story. I have heard success stories with chemotherapy. Patients, they go on to chemotherapy, have side effects, and then they die. And then I hear people who have gone on chemotherapy, very little side effects, and they are successfully beat cancer. I've heard on the other side, people who do natural therapy and then recovered. And then I've also heard of people who do natural therapy and it didn't work and they died. So on both sides, you have your successes and your misses. So what it really tells us is that the fight of cancer is very personal. You've got to see what works for you, have good physicians and good advice. So I think Dr. Jansen and we always try to be responsible because you're asking us a very serious question. So we will say that, pick the option that will work for you. So Dr. Jansen and I, we are not pro PPARS or pro surgery, pro natural or pro conventional medicine. We are pro you defeating cancer. All right. So while you try the natural one first, if it works, great, then continue. If it's not giving you the results, please arrange for a consult with Dr. Jansen. Let's go back and try the other strategies. Because as long as it's stage 1 and stage 2, early stage, your success rate is almost going to be like 90% if you're going to tackle it aggressively. You're gonna beat the cancer. All right. So I hope that's good news for you. Thank you.
So speaking of, Jen Chan's Ang's question is gluten not good for our health because there are foods marketed as gluten-free, or it just depends on health condition of the person? Thank you.
Yeah.
Depends on the person.
It depends on
Okay,
the person.
let me give you an example. Buddhist monks.
Buddhist monks eat gluten exclusively, almost.
Yeah, they live really. Yeah, they live. They go into really quite old. They can get really quite old, no?
And then get the Shaolin monks. I mean, these are crazy people who do like martial arts, you know.
Wait, Doc, what is gluten?
Gluten is a okay. You know wheat, right?
Wheat.
Wheat. Okay, you turn wheat into flour. So you have flour. You make it into dough. So once it's a dough already, you do some processing to it, then you get gluten. Yeah, so it's basically it's an ultra processed
plant derivative,
food.
right? It's a plant derivative.
It's a plant derivative. It came from wheat. Yeah. So for gluten, there are patients who are quite sensitive to gluten, like patients who have celiac disease. They get a lot of reactions because of this. Some people love gluten. They don't even have any kind of reaction when they eat gluten. So it really is up to the patient, no? Yeah.
Doc, and I also suspect because this gluten move or anti-gluten move is Western in nature. It didn't originate in Asia. So for everybody, our food combination is different in different parts of the world, right? So here in Asia, we eat a lot of rice. So I'm not saying this, I'm just saying, imagine, it's like as an example, maybe there's something in rice that helps you to properly process gluten and you don't have all these sensitivities, right? Our temperature is also different. Our heat, our intensity of our humidity, all that is different. Some countries, in the Western countries, are very windy, very dry. That actually affects a lot of things, and it actually affects your sensitivity to the food that you eat. If you don't know, in Asia we don't eat many berries because it's mahal, very expensive. But in Europe, an entire box of blueberries is like $1. Okay, it's like under 60 pesos. So it's so cheap, you know. So they eat a lot of berries. We don't eat a lot of berries. If we start eating a lot of berries, you might have LBM, you know, because again, our bodies are different. So, you know, because Asians have been eating gluten, but we have other things that we don't eat that the Caucasians eat, right, in the Western countries. So maybe that could also be the result of why they have sensitivities to it. Yeah. So again, when you read all these, how should I say, trendy diet tips, right? From keto, and I think my pet, you see Dr. Jansen's nostrils open. Because I mentioned keto, then he's like, oh, there's so many confusion about keto. All these things started in the West, sensitivity, like drinking milk. This one is Dr. Jansen's pet peeve, I think, because dairy is very bad for us. But if you realize something, Asians actually don't drink milk. Our ancestors don't drink milk, right? It's a Caucasian thing. So if we drink milk, we probably have lots of negative side effects as well, right? Yeah. So again, this gluten question, I'm taking it with a grain of salt because I see so many people who actually live eating gluten and they live very long, and their diet is predominantly gluten, right? And we're talking really about the Buddhists. the monks and so on and so forth. Yeah.
Okay, we are raising some curiosity, no? One of our viewers' follow-up question, is seitan, the veggie meat, is gluten?
Let me check. Let me check.
While Dr. Jansen is checking, Dr. Jansen and I think we have come to also the same conclusion. We were both excited because, you know, we are sharing with our viewers yourself to go plant-based. And we were excited in the beginning for things like the Beyond Burger because it actually tastes like a decent, right? In terms like meat-like. But I think Doc Jansen and I don't know, Doc, well, we both agree, right, that those fake meat is like just as bad as meat because they are so super highly processed.
Yeah.
Yeah, and then they use some very revolutionary approaches, especially for Beyond Meat. They add him, which is a particular is it a hormone or molecule? I forgot.
Heme
But
is a protein found in meat.
yeah, but it duplicates the charring effect. That means when you cook it, it gives off that same taste and smell. But they actually have to really extract that from a plant. A lot of science went into it. So, you know, so the Beyond Burgers, all that. But the traditional plant-based, which is a lot of it is gluten-based, right? Doc? Yeah.
Yeah.
You want to answer?
Going back to the question,
Yeah.
seitan is gluten.
It's gluten, right? That's what I thought too. It is basically gluten.
Okay. Going back to PPAR's question from Tinky Anastasio. What is the best PPAR product that you can recommend for triple positive?
Doc.
Depends on the stage. Depends also how healthy you are. Depends on the procedures that you're gonna go for. But if you want a blanket recommendation, it's gonna be liquid and tablets.
Yeah, that's the blanket recommendation. And I explained just now that because the liquid is the best among that. However, again, the best also comes with heavier economic or strain. All right, so not everybody can stay on the liquid for such a long time. So do a combination of liquid and powder. If you're not sure, have a consult with Dr. Jansen. He'll be able to help you optimize for your case.
Yes, okay. Next question coming from Rochelle Esternon. Doc, what kind of scan or procedure to check if there is improvement after or during taking chemo, radiation, and anti-hormones?
Okay, good question. Very, very good question. The type of test that I'm going to use to monitor treatment response is if you have the tumor still inside your body, if you have enlarged lymph nodes, then it's gonna be imaging tests, like CT scan, MRI, PET CT scan. If you have no tumors, if it was resected, if you don't have any enlarged lymph nodes, then the test that I'm going to use to know treatment response is gonna be circulating tumor cells test. It's a liquid biopsy. Okay, so the liquid biopsy, this test counts the number of circulating tumor cells circulating in your blood. Okay, depending on the type of cancer, they have a cut-off. They have reference values for those. Okay, if you're above the reference value, then cancer is still present inside your body. You still have to go on. You still have to go to continue the treatment. If the circulating tumor cells are less than the reference values, then that's the time to stop. You are now in true remission. Okay, so those are that's how we analyze, how we interpret these results, and of course, how I would also know, if you still have active cancer or if there are still circulating tumor cells inside your blood, and to know when to stop the treatment.
Okay, kind of related question from Leticia Bacornay. 13 years ago, I was diagnosed with carcinoma in situ stage 2 after biopsy, okay? I only had selenium and guayabano tea, then I had remission. But when I had the COVID vaccine, my tumor came back. Do I still have to undergo biopsy again? I don't want to touch it. Can you suggest what to do or any supplements?
Oh,
I am
wow.
now 68 years old.
Wow.
It depends if you want to undergo conventional treatment or not, no. However, since you have a tumor, my suggestion is to have it removed. Okay, surgery is still the best cancer treatment, no, that can give you the most increase in survival rate. Okay, if the tumor is not there, the burden of cancer significantly drops. Treatment becomes simpler. Yeah. Okay. Now, if you don't want to go for the conventional path, no, chemotherapy, radiation therapy, whatever the onco plans to give you, even if it's not chemotherapy or radiation therapy, then what we can do is to treat you metabolically. Try to check, no, if there are any metabolic aberrancies present inside your body, like diabetes, high blood cholesterol levels, fatty liver, these kinds of illnesses. Number two, it's to lower inflammation. Okay, there are supplements for that, plenty of supplements, like Simply Nature PPARS. Number three, you have to detox. You mentioned that the COVID vaccine might have been the trigger that led to the increase in size of the tumor. So we have to detox. So we have to begin to detox your body. So I have mentioned that my protocol already, no, a while ago. So the first thing that I would do is to detox. Yeah, that's the first thing that I would do. Then try to address the tumor at the same time or after or just after the detox, no? Try to address the tumor. Another one is to destroy the tumor directly. So the specific procedure that I use for that is high dose intravenous vitamin C. So you might be wondering, how would vitamin C kill tumors? I mean, vitamin C is vitamin C. How the hell can it dissolve tumors? Okay, here's how, no? Um, Cancer cells inside them are very rich in iron. So cancer cells have very high iron inside them. They're also devoid of catalase. They don't have catalase. Okay? So when we give vitamin C enters the cancer cell. Why? How does it enter the cancer cell? The molecular structure of vitamin C and glucose is similar. So when we give you vitamin C, the cancer cells would be able to detect the vitamin C as sugar, and they're gonna assimilate it. They're gonna eat them up. Also, your body is going to detect the vitamin C as a sugar molecule. So your body will produce insulin. Insulin will also attach to the cancer cell and open the glucose channels. So vitamin C goes in. When vitamin C goes inside the cancer cells, it will react with the iron. So the iron, this reaction will produce hydrogen peroxide. Hydrogen peroxide is the one that's gonna kill the cancer. Now, will this affect my healthy cells? No, because healthy cells have intact catalase. Catalase is an enzyme that eats up hydrogen peroxide. So this is selective killing of the cancer. No? So the question here is, what dose do we use? It actually depends on your body, the present health of your body, your weight as well. But I use a glucometer to determine, no, if we have reached the cytotoxic effect already of vitamin C, or do we still have to increase the dose, no? So these are just some of the treatments that I use, no, if you don't want to go for the conventional approach. Basically what I address is your metabolic health, okay? The tumor microenvironment, which means that the environment surrounding the tumor and the tumor itself. So these three aspects. Yeah.
For me, what was really interesting is that you mentioned that after taking the COVID vaccine, the tumor came back. So the COVID vaccine is the tooth version of the actual virus, right? So one thing that it's that everybody agrees now is that whether you had COVID or the vaccine, all right, there is long-term inflammatory inflammation in your body, right? So there's increased long-term inflammation in your body, and that does compromise your immune system. It's like imagine putting your car running all the time without an off switch, right? So that's going to cause some issues. So anything that modulates inflammation would be helpful. So the good thing about PPARS agonist is that it helps to modulate inflammation. Now, how that will exactly interact with what the vaccine has created or might have created is something that we will only know with more time and user experience, right? Okay, the other thing that is quite predominant is not only increased inflammation, heart issues are very closely linked to COVID vaccines, right? Linked not with the kind of case study link, but really it's quite interesting that if a my nephew when he was born, he had a slight complication with his heart as a newborn baby, and surprisingly his pediatric doctor, first question the doctor asked mother, did you take the vaccine and which one? Right? It's very interesting that, you know, when doctors ask questions, it's because they see enough. I mean, the textbook tells them this is a possible cause, so you ask the patient a question. So obviously, the doctor, the cardiovascular specialist saw enough cases that there is a correlation. That's why he actually asked this question, right? So just so again, I think the people, at least the tablets, again, the one thing I so comfortably recommend tablets to everyone because I have been taking the tablets ever since I was 27 years old. I just turned 50 years old. So one of the wonderful effects is it helps you age very well, okay? And it's good for all sorts of general health. So you're not going to lose anything. And now you actually have a specific concern. And the mechanism of action, how the product works, actually addresses some of these concerns. So it's going to be like the best general multivitamin supplement that you can start with. Don't just stop here. You can explore other supplements as well as to add to make it complete. But this is really one of the best foundational ones. So I would suggest you can start with, again, try 1 month of the soft gel, then go down to the tablets and see how you feel generally in your own health. And I'm quite sure if everything is benign, even though your tumor marker's up, but you don't know whether it's malignant or benign, right? So if everything could stay benign, then it's just going to be such a good basic foundation for you to maintain your cancer-free health. Yeah. And on top of that, you know, if you ever feel you need a boost, you can go for ozone therapy. Doc, ozone therapy is a great booster for energy, right? Doc Maddie was
Yes.
yeah.
Yeah,
So
it
you
is.
see, so although we are talking about cancer all the time, after you get well from cancer, there's still quality of life that we're talking about, right? And there's also quality of life while you're undergoing cancer treatments. So today, whatever we are sharing about is not just about beating cancer. It's also about how you go through that journey. Okay, so I hope that's helpful for you.
Okay, next question is thrown to us privately from Red Peralta. The question is, can PPARS affect PET scan result?
No, it won't. It won't.
Yeah, won't interfere with your PET scan.
Okay.
In fact, it would be able to protect you from the radiation you get
Protect you
from
from
the PET
radiation.
scan. So,
Like Iron Man. I say that because if you ever watch the movie Iron Man, I think it's Iron Man 2, he's constantly drinking this green green liquid from a water bottle. It's actually based on the fact that microalgae like our Simply Nature PPARS are excellent radiation and heavy metal scrubbers. So at that time, if you remember the movie, Iron Man was actually suffering from radiation poisoning from his the thing in his chest, right? The power supply put in his chest. So he was just drinking liquid algae to help scrub radiation out of it. So that's why Dr. Jansen says it's protective.
Okay, the next question is a very curious viewer from Miss Eden Etorne. Her question is, which has better prognosis? Number one, triple positive. Number two, ERPR negative but HER2 positive. Or number three, ERPR positive but HER2 negative.
The best one is ERPR positive, HER2 negative. That's the best.
Mm.
That's the type of breast cancer with the best prognosis.
There we go.
There-
Answer.
there-
Very to the point
Okay.
because the question is very specific.
Okay, next question from Miss Christine Banog. What is the role of menstruation to a ERPR positive? Does being menopause reduces the chances of breast cancer recurrence?
Yes, it is better. It has a better prognosis because the amount of estrogen circulating inside your body is low already. However, this is of course assuming that you have eliminated all sources of estrogen from your diet. Okay. Now here's another school of thought that I have heard from other doctors, no, practicing bioidentical hormone replacement therapy. They are saying that bioidentical hormones or bioidentical estrogens don't stimulate the growth of breast cancer. So it's counterintuitive. This I have to still learn more about. I'm not quite sure how what the mechanism is or what makes bioidentical hormone or bioidentical estrogen not not stimulate the growth of cancer, no. This is also the same for testosterone, no, for men, for prostate cancer. So I'm not quite sure what I don't know the mechanism of that. So I have to learn more, attend workshops, attend conferences about this. It's actually my next project, learn bioidentical hormone replacement therapy. So I cannot answer you now, but for everyone's information, no, just know that estrogen sourced from dairy can increase tumor size. Not really, not just because of the estrogen in dairy, no, but the protein in dairy as well, which is casein and whey. All right. So just keep this in mind. Now, is undergoing menopause gonna be beneficial or increase the betterness of the prognosis once you cross menopause? My answer to that, theoretically speaking, no, is yes. No, because of course, no, again, the amount of estrogen, simply the amount of estrogen present inside your body goes down already. But of course, it's there's more to it than that, no, by just simply making that claim. There are other factors, so those other factors have to be considered as well, no? Yeah.
Okay, we're almost at the end of the webinar. This will be our last two questions for tonight. First question is coming from Annabelle Noll. Good evening po. I have a question about, okay, can I use PPARS on a triple negative breast lump after chemo and oral chemo? If it's possible, what is the best PPAR product that I was going to be used?
PPAR liquid.
Straight out.
Use the liquid.
Okay. And then, okay, last question from Janet Tadeo Odon. Good evening, everyone. I have a question po. Usually, every time I do the laboratory before chemo, my WBC is low. So just wanna ask how to increase my WBC. I'm already taking PPARS powder. Thank you.
Okay, my question to you is how low? Because there are WBC levels which are acceptable. Okay, which are acceptable for a patient undergoing chemotherapy. So I won't focus too much on the numbers. I would focus more on whether or not you're getting adequate nutrition, whether or not you're getting, infections at all. These will determine your resistance, your immune system function. I would also look into the amount of neutrophils and lymphocytes present inside your body. So the absolute neutrophil count and the absolute lymphocyte count, and try to see, how much how much lymphocytes are there compared to neutrophils. From that, I can say if your immune system is functioning well or not. Yeah.
No, I have a question for you. This one is because I dealt with patients that actually they're doing novel chemotherapy. So that means experimental chemotherapy drugs, and their RBC count dropped, right? And then they couldn't get it to rise up. So that's when they came to us, and they take liquid, and literally like within like 72 hours of less than a week, the RBC count goes up. So I'm just asking this question because so far it's not WBC count, the chemo patients that I see, right? It's not the WBC count that they want to increase. It's actually the red blood cell count that they want to increase. I see very dramatic white blood cell count increase in dengue patients. So literally within 12 hours, the white blood cell count escalates very quickly if they take like either the powder or the liquid. So this patient is already taking the powder. So I was thinking, okay, maybe you need something stronger, but not on a sustained basis, maybe just for 1 or 2 days, and then you might. No, I'm just asking, is there a difference in your experience, the PPAR liquid's ability to raise the count between RBC and WBC, or it's basically the same thing, right? Same stem cells developing, yeah.
It's the same stem cells.
It's the same
because it's same stem cells. Red blood cells and white blood cells comes from the bone marrow. So the bone marrow stem cells, the precursor of red blood cells and white blood cells, are the same. They are hematopoietic stem cells, no?
Yes.
So if PPARS, since it's a gene activator, it can stimulate the differentiation, the proper differentiation of blood cells. Differentiation, this just means maturation. Okay, so this is what it does. No, this is what it activates with our genes. It's one of the benefits of PPAR. So I think this will explain why you see a sudden increase in RBC, sudden increase in white blood cell counts of people taking PPARs. No, but of course it's there's more to it than that. No, of course if you are continuing to take chemotherapy, the counts are gonna be low. Definitely.
Yeah. Under pressure.
The medications kill the white blood cells and the red blood cells, right? So once you stop taking these molecules, no, that causes the decrease, then you would be able to see a gradual increase or gradual normalization of your blood cell counts sooner or later. However, there is this danger zone. There is this danger zone wherein it would be quite dangerous if it drops below this level because the patient can die. I am a doctor wherein I usually don't mix PPARs with chemotherapeutic drugs or things that oncos prescribe. No, I have my personal.
Just to clarify, you don't mix it to ask them to take it together. But you ask them to take
I use them. Yes. I use them in the same protocol. So oncos give the chemotherapy, etc. I give PPARs, no, side by side. However, I don't ask the patient to take them at the same time.
Yeah,
okay?
In one
usually
same day, yes, but not same time.
yes. So the reason is to avoid unknown interactions that we might know of, just to be safe. We don't diminish the effect of the chemo. We don't diminish the effect of the PPARs because PPARs are microalgae. These are really very good chelators. No, these are really good chelators. So, when would I decide to give to tell the patient to take the chemotherapy and the PPARS together. It's when your white blood cell counts go below this danger zone. This danger zone, when will I decide though? If your white blood cell count is 2 or below, then I will tell you to take them together already. Okay?
So
yeah. This is for chemotherapy medication that I know of that is gonna interact with the PPARs, no? But for chemotherapeutic drugs that work synergistically with PPARs, of course, it's gonna be the same at the same time, right? So yeah, so it really depends on what kind of chemotherapeutic drugs that you're taking. That's yeah, it really depends on that. Yeah, that's the key.
And you know, when Dr. Jansen shared how if your white blood cell count is at the danger level, you would actually be taking the PPAR liquid, you know, because I'm quite sure at that point it's the liquid. So it just goes to show that how well we understand the mechanism, how confident we are on how it will work well together with chemo if you're undergoing conventional treatment like chemotherapy, right? So you've come to the right place tonight if that's your modality that you. And the good news is you can do a teleconsult with no matter where you are in the world or no matter where you are in Philippines. And you can see from tonight's conversation, this is Doc Jansen and I, we do know what we are talking about. Doc Jansen is so familiar with the actual chemotherapy drugs that you're going to be taking. You know, so I always caution, if you're talking to a doctor who doesn't even know or recognize the chemotherapy drug that you are taking, then how can he properly advise and take care of you, right? So I think that's, I hope tonight's conversation, we were quite specific tonight, gives you confidence and give you some better understanding about the protocols you've chosen. All right. Okay, Jhen, I think, wow, tonight is so long, Doc, because the lecture was only 6 minutes. We have been actually answering questions for more than an hour. Wow, okay.
Wow.
Okay.
Okay,
Last words,
looks like
Doc.
we've covered all our questions. So as we wrap up this evening, we'd love to hear your final thoughts for our viewers.
Parting words, Doc. You first.
Yeah, I just want to thank all of you for those wonderful questions. You're learning from us. We're also learning from you guys by asking those questions. No, so this is really a very helpful, a very healthy discussion that we have, that we had. No, and for those of you who have questions that we weren't able to answer, and for those of you who, you know, I need to see you personally to answer your question, like Miss Remy Martin, no. I have to see you. I have to talk to you to answer your question. So if you're that someone, if you're like Ma'am Remy, please set an appointment, no? My consultation slots are getting full quite fast, so it would be better if you set up your appointments quite early. I have a lot of trips in the next few months. So yeah, if you really are interested in seeing me, then please set up your appointments early. Okay, so that's it. I just want to, if people are quite bothered by this patch on my neck, I just had a procedure a while ago, no. So I hope it.
I actually thought that your mask is hanging under you.
No. It's a bandage. No, I had my derma said it was a pyogenic granuloma. So it happened when I was shaving. It has been there for 10 plus years. My God, it was just now that I was able to have it removed. Yeah, we didn't send it for biopsy anyway. It looks benign. So that's the reason why I have this patch up until now. So
there you go.
That's it.
Walks his talk, right? The best way when you have an unusual growth is to have it removed. Yeah, when the doctor recommends for it to be removed, then have it removed. Amen. Yeah. My parting words is thank you everyone again. Tonight's discussion is really good. I really enjoy our exchanges, and I really appreciate the doctors that come on our program, especially Dr. Jansen. you would notice that Dr. Jansen will actually check before he answers you. And that actually gives me confidence, right? You know, what's scary is a person who seems to know everything because nobody knows everything, right? So you don't know whether they're just, you know, whether they know or they are just making a guess. So on our program, one thing we can assure you is if we're not sure, we'll give you a truthful answer, right? And I hope that gives you confidence, and it also means that you understand that we're on a journey together. And you will find that those of you who come, if you've not attended our program for 6 months and then suddenly tonight you're back here with us, you realize that some of the things that we talk about is slightly different already. So as we go along, our knowledge does improve, right? So we can give better advice, more specific advice when it comes to your journey, your medical journey, and your needs. And I hope that you continue to join us. We look forward to this every Thursday. All right. Thank you and have a great weekend ahead.
Yes, thank you, Doc. Thank you, Sir Shyan. And thank you for all our viewers for participating in today's seminar. And remember, understanding the type of breast cancer is the first step toward taking control of the healing journey. And we hope today's session has provided you clarity and empowered you with knowledge. If you have any follow-up questions, don't worry. We will answer each of your questions next webinar or via direct message. We hope to see you again in our future webinars to come. Same day, same time, every Thursday night at 7:30 p.m. Next week, we will look at lung treatments and solutions from a doctor's perspective. And next, I know some of our viewers are already enjoying this, so don't miss out on the much-awaited Lazada's 10/10 October Load Fest until 14th, Monday. Back-to-back with another Lazada Sulit Sweldo sale. So it's the premiere episode of our new segment, Simply Nature Answers. It's packed with lots of promos and raffle prizes, so don't miss it. Next week, that's Wednesday, October 16, 4 p.m. It's also simulcast on Facebook. So if you'd like more information on how Simply Nature PPARS can be a part of your healing journey, please don't hesitate to reach out. Stay strong, stay positive, and remember that you are not alone in this fight. So thank you once again for watching Simply Nature webinar powered by SMG or Simply Healed Medical Group, because your curiosity about your health condition and your victory over cancer and metabolic diseases is what keeps us going. Here in Simply Nature, we are always with you from start to healing.
Today with a Simply Nature Power Pack, a 5-day combo pack of Simply Nature PPARS tablet for immune boosting and Simply Nature Cleansing Plus for effective detoxification. Now is the best time to try our Simply Nature products. Available on our official Shopee, Lazada flagship store, our website www.simplynature.asia, and our office in BGC Taguig. Order yours today. Click the link on the description box.
Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong, and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who are real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
One reason why I recommended initially PPARS is because it can induce lung cancer cell death. The main reason why I tried PPARS liquid, and it did well for the patient. It helped with the tumors. The enlarged abdominopelvic lymph nodes were not detected. This was gone. So that was something that I was actually quite surprised. A 12-centimeter tumor disappearing.
Everybody turn to your neighbor and say, do more. Right? Don't just think there is no one product that will cure you of cancer. Okay, that is like it's like a scammer trying to sell you something. All right, it is a comprehensive approach. When you need surgery, do the surgery. Or prepare for the surgery so that you recover well, right? And then if you need to do chemotherapy, radiation therapy, do it. So this is where PPARS really comes in. It's a gene activator, so it's a signaling pathway. It switches on your pathways, your systems. Then the other nourishment that you take will be properly used. Is it easy to understand now?
Now let's not keep you waiting. We are now officially opening the AMA or Ask Me Anything portion.
So she has to take maybe just the capsule or the powder just to regulate blood sugar, and then undergo the surgery. And after the surgery, to aid in wound healing also and for recovery, she can continue the capsule.
I can safely say this, all LJ products are great. But if you have acute illnesses like cancer, then we are a world of a difference. Because if you want chlorella, take chlorella. Diba? If you want spirulina, take spirulina. When you take Simply Nature PPARS, you're taking our microalgae for its PPAR agonist.
We are always with you from start to healing.